Yes, we can see
Yes,
us.
we can see your screen.
Okay, so um, cancer, basically breast cancer. So let's just start straight to the point. These are what I'm doing. Talking about cancer in women, breast cancer in Africa, breast cancer in Nigeria, etiology of breast cancer, pathogenesis of breast cancer, mutation and breast cancer, BRCA1, BRCA1 gene in cancer, BRCA1 gene in breast cancer, BRCA2, BRCA2 gene in breast cancer, and BRCA2 gene in cancer. You will understand everything as I go forward, as I start from the first one to the last one. Then you know this BRCA1. What's cancer? Cancer can be defined as a group of diseases involving abnormal cell growth. That's what it is. Apparently, is basically the group of disease that involves the abnormal cell growth that has the potential of invading and spreading to other parts of the body, and there are also genetic diseases that is changes in our gene function, blah blah, blah and usually it affects the way the genes grow and the way it divides. It's basically the opposite of being tumor. Everybody know what tumor is. Tumor is mass of cells, basically. So like, and being tumor basically it doesn't spread. It just grows. That's basically the opposite of cancer. Cancer is going to grow and it's going to spread. And up to 5 to 10% of cancer, and due to the inherited mutation. So 5 to 10% of cancer is due to inherited mutation, genetic defects. That's in majority of cancer, and also cancer is mostly 22% from smoking of tobacco. So, and that's basically like the highest rate of cause of cancer. Basically, then the second rate could be is obviously the one that we inherit, and there are up to 100 types of different cancer: cancer of the lung, cancer of the many cancers. Straight to the next one: cancer in male and female. Most common cancer in both are the colorectal, stomach, prostate, lungs. That's for male. In female, breast cancer, lung. Breast cancer is the most common. Lung, colorectal cancer, cervical cancer, and so on. While in children is the acute lymphoblastic leukemia and brain tumor. But in Africa, non-Hodgkin leukemia. Signs and symptoms of cancer: lump, abnormal bleeding, unexpected weight loss, change in bowel movement, prolonged cough can lead to cancer. Um, these are sort of signs and symptoms that you expect to see in cancer. Cancer in women, breast cancer is obviously, like I mentioned before, is the most common type of cancer in female, and basically there's the colorectal cancer, there's the lung cancer, cervical cancer, ovarian cancer, etc. But breast cancer is the most common cancer in women, and women 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 at high risk are the most ones that they are inherited from the family, basically genetic mutation, because the genetic mutation can be inherited from their parents, so and it spread onto the family and different types. Okay, sorry. Breast cancer. Breast cancer is cancer that develops in breast cells. Okay, it's also found in men. So a man too can also have breast cancer, but it's just mostly found in females because if you inherit the mutation genes, that's where it happens in male because of because a male too can also have breast cancer, but basically females are the ones that have breast cancer, and it mostly happens with 50 years. It mostly comes out when the person is up to 50 years upward, but you can still get it even at a younger age. So there's no exemption, but it's mostly common in 50 years. So symptoms, obviously, first noticeable are the lumps and the hardening parts of the breast. Basically, your skin, you see that at the area of the breast, you see that an hardening of the breast. That's where either you know that okay, you're having symptoms of cancer. And lump, obviously, you know what a lump is. Change in size and shape, obviously, what I just said, the change in the skin and this thing. Um, discharge from the nipple with blood from like where the milk comes out from, basically with blood. Lump in armpit, dimple on the breast, rashes around the nipple. The rashes depend on around the nipple. Then there's also the inverted nipple, peeling, scaling, flaking of the nipple, changing the appearance of the nipple, sucking in of the breast, like the nipple basically sucks in. Obviously, we know what that means. Types of breast cancer: there's non-invasive and invasive. Invasive is obviously invasive. Non-invasive is when the cancer is still in. Sorry, let me show you guys again. Non-invasive is when the cancer is still in the duct, while invasive is when the cancer has spread from the duct to other parts of the breast. The the auxiliary lymph node, the lymph node tissue close to the lungs. That's when they're spread into. That's so invasive is obviously a serious one. Non-invasive is a serious one, as you can see here, and also fibrous connective tissues and that. This is not a type of breast cancer, but it's also an important thing that you note. Metastasis is when the cancer has spread from the breast to the other parts of the body, and it happens through the blood and the auxiliary the blood or the auxiliary lymph nodes, and e.g. other parts of the body like lungs, other parts of the body, basically other organs of the body. Stages of breast cancer. So there are up to 5 stages in breast cancer. The stage 0 is the DCS. DCIS is defined as the ductal carcinoma in STU. In SITU is basically on site. That's the meaning of it. So basically, that's what it is, and this is when the cancer is confirmed that yes, it's in the duct. This stage 1 and stage in different places I checked. Yes, some may call it just stage 1, some may call it stage 1A and B. Just for better understanding, I used this one. Stage 1A and stage 1B. Stage 1A, main tumor is 2 centimeter wide or less, and the lymph node is not infected. While stage 1B the cancer is there and the lymph nodes get affected, and it's obviously not as large as 2% or less. Then stage 2A, the tumor is less. The tumor is less than sorry. The tumor in stage 2A, the tumor is less than 2 centimeter and has spread to 1 to 3 lymph nodes. Lymph node, obviously, know what the lymph node is. The lymph node is around the breast. Is what the lymph nodes and the ducts. Obviously, they help in the production of milk and everything that is discharged from the breast. So basically, all this basically that's where the cancer increases. So when it increases to stage 2 and stage 2B, the tumor becomes 2% less, and it has increased to other 1 to 3 lymph nodes. And if it's stage 2B, the tumor is already increasing to 5 centimeter large, and is also going to increase to 1 to 3 lymph nodes, or it's also going to be only in the duct, and it's going to be 5 centimeter large. So, stage 3A, the tumor has spread to 4 to 9 axillary lymph nodes. This is already increasing and already getting serious, and has increased in size larger than 5 centimeter, and also increased the mammalian lymph nodes. All these lymph nodes are found in the breast, and you will know them. The cancer has invaded to the chest wall in stage 3B, and skin and internal mammalian nodes. This is when you now start seeing the features on your breast, when the cancer starts showing on your breast skin, because they already start showing skin and it's hardening of the skin. That's stage 3. And stage 4 is basically, you can also call it the metastasis, because it's already gone to other parts of the body and has spread. Breast cancer in Africa. The average age of diagnosis in cancer tends to be 50 years or younger. So this is even worse. So it's bad in Africa. Few African women live past 65 years of age compared to women in developed countries. And breast cancer develop uniquely. African women develop breast cancer tumor subtypes, which could also be an important contribution in factor that usually age distribution, as noted before. Tumor features in Africa, most from what the study has said, is that a high frequency of poorly defected tumor. 70%, more than 70% of patients have had stage 3 tumors. That's basically the tumor already started for the already identified. You already at stage 3. So This is and because of the if because of this is that's why it's bad in Africa basically because of this before we don't get to um identify the breast cancer tumor until you go to stage 3 because of because and that's in stage 3 that's when the things start becoming um obvious on the body. So that's when people now start noticing that okay, I have cancer instead of when it's still not obvious yet at stage 1 or stage 2 or stage 0. Um, Lack of organized screening detection program, potential but potentially more aggressive tumors. That's basically in Africa. That's a summary of it. In Nigeria, our country, breast cancer is very common in Nigeria women. Let me note something. Breast cancer is common mostly worldwide. So most definitely almost up to 70% of the countries in the world have an high rate of breast cancer in women. So it's very, 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 very common in women. So also in Nigeria too, it's also very common. And the incidence of breast cancer has increased from 13.8 to 15.3 per 100 to 100,000 to 3.6 per 100,000 too. And this is in 1992 and has already increased to 116 per 100,000 in 2001 and you see how bad it's going to be if you have a current figure which I couldn't get, but it's going to be very bad. So non-conclusive evidence that non-conclusive evidence that is common that's common among urban and dweller that sorry basically from this second note it says that the urban dweller has kind of higher rates of the rural community. So but in Nigeria we don't have the conclusive um, evidence on that. But fortunately all this is possible all this is not possible for early detection because of why potential range from the religious belief, prolonged denial, lack of awareness, urban and spiritual treatment option, less friendly hospital environments, fear of mastomy, mastectomy. Mastectomy is obviously the removal of a breast, basically the whole breast or one part of the breast that has the affected cancer, basically. So poor health condition, adequate facilities, and ill-formed perception about cancer. Basically, lack of awareness or no people are not aware of breast cancer, and when they not get aware, they get denial and they don't want to accept that oh yes, I have cancer, and the list goes on and on and on and on. Etiology of breast cancer. Basically, cancer arises by the inherited cancer genes, tumor gene suppressor, or tumor suppressor genes. Um, Yeah, also caused by person's lifetime as a result of smoking tobacco. Tobacco, like I mentioned before, tobacco is a very, very um effect of of cancer as a whole. Alcohol too also causes breast cancer. Bad diet also causes breast cancer, and obesity is obviously a cause of breast cancer. Lack of physical activities by exercising, moving around, being active, jogging, going to the gym to be precise, but not being healthy causes breast cancer. And tumor, non-cancerous. If you have a tumor which is not cancerous, it doesn't mean that oh because it's not cancer, it's not a cancer, so it doesn't mean that you don't have cancer. There's a possibility that you can also have cancer from just having a tumor or a benign tumor. Most risk factor, age is very, very important. Age, because like I mentioned before, 55 years and above tend to start having symptoms of breast cancer. Um, Having dense breast tissue, gender. When I mean gender, I mean both male and female. Um, also have cancer. Genes, the BRCA1 and BRCA2 mutation, and other mutations, not only the BRCA1 and BRCA2 mutation, can also lead to breast cancer. Early menstruation. Basically, this early menstruation is abnormal because people normally you're meant to start your menstruation at the age of 12. Then you now have you now have your menstruation less than 12. That's the symptoms of that's a symptom of breast cancer. It's possible that you can be having the symptom of breast cancer and it needs to be checked. and giving birth at an older age obviously leads to breast cancer. Hormonal therapy, this with estrogen leads to breast cancer. Late menopause start also leads to breast cancer. Late menopause, normally your menopause is meant to end. It's meant to be around the age of. It's meant to be around the age of 55. Yeah, I think 55. Um, Basically 45 to 55, you may start your menopause, and if you have not started menopause at that age, and you're still at 56 or 57, and you're still menstruating, and you've not started menopause, it's a symptom of breast cancer and should be checked. Never been pregnant too, it can also cause pregnancy. And previous breast cancer, basically, if you have had breast cancer before, it's possible that you can still have it again. So keep checking. Quick notes: most often, the cancer causes gene accumulates from the persons that they would, like, basically, when you inherit this gene, this mutated gene that leads to breast cancer, it doesn't obviously start immediately as you're a child. You could keep growing, keep growing, keep growing. As you get older, then once you get to the older age, that's the age I already mentioned before, it's very, very possible. It's very, very possible that you can have these cancer cells to grow and become the risk for breast cancer or other cancers to be precise, to mention too. Pathogenesis of breast cancer. Damage to the DNA and genetic mutation can lead to breast cancer. Have been experimentally linked to estrogen hormonal exposure. Like I mentioned before, the estrogen. This is where I mentioned it. The early menstruation and also the late menopause starts. This is what it's just talking about here. It's estrogen hormonal exposure. Estrogen basically is what kind of um feeds the female cells. Basically, it's basically what is the hormone that basically is there to basically how should I put it now? The hormone basically is the estrogen hormone is basically a female hormone for female um parts of the body, something like that. Yeah, basically, so that's what estrogen is. So, like, if the hormone is exposed, it can also lead to breast cancer. And from the first monthly period to menopause, estrogen is being released. Estrogen stimulates normal breast cells. Okay, yeah, this is what it is. It stimulates breast cells and other parts of the body. Basically, error in the estrogen process, like starting menstruation at an early age and or ending at an older age, like I said before. As a result of error that occurs during cell division or causes of damaged DNA caused by environmental exposure. This again, let me explain it. As a result of error that occurred during cell division and or because of damaged DNA caused by environmental exposure. This happens when the DNA is being when the DNA is sorry. This happens when chemicals enter the body or radiation or ultraviolet ray light from the sun or other things that affect that are also bad from the environment and from the diet and everything. When they enter the body, they could cause error and that occurs during cell division and damage the DNA to and which I'll get there later. But once something affects your DNA, basically from outside from your lifestyle or lifetime, basically what you take in, the chemicals could affect the DNA, and the DNA will need repair. And if the BRCA1, BRCA2 doesn't come to repair it, and other genes that comes to repair DNA, then you're likely of having cancer. Some individuals inherit defects in the DNA and genes like the BRCA1 and BRCA2 and P53 among others. This P53 is also among the genes that also leads to cancer if there's a defect in it. Mutation and breast cancer. Like I mentioned before, 5 to 10% of breast cancer causes are hereditary, passed on from parents which are mutated genes. The most common gene that gets mutated are the BRCA1 and BRCA2 genes. These genes are the genes that make proteins and that helps repair damaged DNA in a normal cell. The BRCA1 BRCA2 gene, like you said there, they helps to repair damage in the DNA. So imagine if these BRCA1 BRCA2 genes and other genes like the P5 theory, like I mentioned the other time, affects is affected and can't repair a damaged DNA. It grows and it leads to cancer. Inheriting the genes gives a very high rate of having this disease, and also ovarian cancer. Not only the breast cancer can also be gotten from the defect in the these genes. You can also have ovarian cancer in female, and in male, you can have prostate cancer. So these genes, if they're not intact, it can also affect the male too and the female. Also, the amount of family member with this disease increases the rates of getting it. So if you have a lot of families that have had this breast cancer, maybe a close friend, a close family member, a close family has had cancer, it's possible that you can have it, and the amount of people that have had it can also have it. Okay, these are also the genes that can also be mutated and can also lead to cancer, but they can lead to cancer, yeah, but they're not very prominent in lead to cancer. The prominent one is the BRCA1 and BRCA2 gene. This ATM also helps in the gene, basically helps in the gene repair, in DNA repair. Most of them helps in DNA repair. Most of them basically are affected with DNA. There's the T550, like I mentioned before. This T5, this P3 holds the DNA strand when it's moving, and so the BRCA1 and BRCA2 gene can come and fix it. So imagine if these genes don't come to fix the affected DNA area, it could lead to breast cancer and other cancers, prostate, cervical, pancreas cancer, that could lead to it. Now we're on BRCA1. BRCA1 is a protein in human that is encoded by BRCA1 gene. It is a human tumor suppressor gene and responsible for DNA repair or helps destroy cells that can't be repaired. BRCA1 also combined with other tumor suppressor, DNA damage sensor, and signal transducers to form a large multi-subunit protein complex, which as the BRCA1 associated genomes, which is known as the BRCA1 associated genome surveillance complex (BASC), which plays a role in transcription, DNA repair, transcriptional regulation, and
Wait,
other functions.
I didn't ask you to come here and start reading to us, because it's defeating the purpose.
Yes, sir. Let me
Tell us
explain. Let me explain.
about BRCA1. We can read ourselves. Tell us what you know about BRCA1.
Okay, let me explain now. Basically, like I've mentioned as I was going, BRCA1 is used to is BRCA1 basically is a tumor suppressor gene. So basically, what the main function and the straight to the point function is that it helps. It does not even help. It basically is in control of the DNA repair. Is if the BRCA1 is not there, DNA cannot be repaired. So BRCA1 is the final say. It basically recruits other genes and it fixes the DNA. DNA that has been um been destroyed basically, or damaged. So basically what BRCA1 do, like I mentioned, like in this complex, it brings all these other multi-subunit proteins. It's a protein, let's put that way. Don't forget, sorry, I don't think I mentioned that BRCA1 is a protein. It's a protein. So basically, this BRCA1 brings all these other DNAs and form a complex. And this other DNAs helps in DNA repair, also helps in transcription, also helps in transcriptional regulation and other functions. This, like I mentioned, the ATM, the P5 and the rest, the BRCA1 kind of recruits them and brings them together so they can fix the DNA it can repair the DNA that's been affected. BRCA2 gene is a human, or is something that is, they're not the same thing, but they do the same purpose. So DNA is also a gene, is also a gene, and it's also a tumor suppressor gene basically, and it's involved in repairing the DNA too. And they basically do the same function like I mentioned the other time. The DNA gene provides instruction to make protein to act as a tumor suppressor, basically. And they help in regulating cytokines to which also step in for cell division, and cell division also related with DNA repair. So basically, like, it divides to form two separate cells. So BRCA1 and BRCA2 in cancer. BRCA1 and BRCA2 in cancer can also lead to other cancers, not only breast cancer, because this is, like I mentioned, the pancreas cancer, prostate cancer, cervical cancer, and other cancers that BRCA1 can also lead to, and BRCA2. So BRCA1 and BRCA2 gene and breast cancer, this is where it comes in place. So things that damage our cells, like radiation, mixed in our cells. So the DNA encodes the information needed to make protein, and protein, obviously we know protein as the building blocks of our body. So the last point that I can see are the things that could affect the DNA: single strand breaks, double change in the DNA code, DNA sticking together, and changes that occur in the DNA. And there are up to 1 million changes that happen in the body per day on the DNA. So these are the things that single strand breaks. All these things are bad for the DNA. They obviously destroy the DNA. So I would like to explain how BRCA1 comes in place to save all these breaks, and also how it can also lead to cancer and other cancers, and breast cancer, basically. So basically, the first step that comes is that there's a machine 1, MR1, that comes to the affected sites. It rolls around, it swims to the affected site, and it activates. And ATM, it activates ATM, which makes series of interaction with the around the DNA surroundings. It makes interaction with around that affected DNA surroundings. Basically, is also activating too. Then machine 2, RN58, builds a chain to link to the machine 3, which is RNF168. Then machine 3, RNF168, builds another chain to complete this chain. So whereby after all this thing has been made, then BRCA1 now comes in and forms, which is formed from two identical orbs, and come together to bind and binds. Then BRCA1, sorry, I think I'm reading and I don't want to make me understand. Basically, let me just say it. This BRCA1 now comes in, and it's formed from two identical orbs. It comes in and begins the recruitment of other complex that carries out the actual DNA repair. So without this BRCA1, the DNA is not going to be repaired. And the BRCA1 that actually makes the repair, that gets everything done and finalizes it. So imagine inheriting this BRCA1. So inherited changes in the BRCA1 area, where the DNA repair alters the protein so they can interact. Sorry, let me just. Okay. Basically, when you inherit this BRCA1 gene, or BRCA2 gene, you inherit the mutation of it, and the mutation of it obviously is bad because it's not going to allow the BRCA1 and BRCA2 gene carry its function by fixing DNA that is being damaged. So this damaged cell will lead to. Sorry, let me just read this out for you guys. Inherited changes in the BRCA1 area where the DNA repair alters the protein so they can't interact with the identical half. Therefore, the DNA repair process.
Stop reading. Tell us what you know. Can't you ṣàlàyé ni?
I can ṣàlàyé, sir.
Yeah, ṣàlàyé now.
Mom. So basically, when, like, I've mentioned this BRCA1 continuously, and I feel like that's basically the summary of the whole thing. So basically, this BRCA1 gene, and BRCA2 gene, they helps in DNA repair. Okay, so if this BRCA1 and BRCA2 gene is being damaged, there's this orb that I mentioned, the two identical orbs they won't be able to they won't be able to interact with each other again. Then and therefore makes the DNA repair process interrupted, and it will now lead to more and more DNA damage over time. So basically, the damage of DNA keeps growing, it keeps growing, it keeps growing. So there's no BRCA1 and BRCA2 gene to come and repair it. So the damage keeps growing, and it becomes the DNA becomes affected, and it keeps growing. And this alteration in the BRCA1 and BRCA2 gene leads to an increased rate of cancer. So basically, if the BRCA1 keep growing, and so if the DNA repair that was not able to repair and it doesn't get repaired, the problem keeps getting worse and keeps getting worse. So it grows and it grows, and there's this gene that obviously fuel the growth of it, which is R2, HER2. I didn't put it there. So basically, that also fuels the growth of this cancer, basically. So, and from there it leads to breast cancer, ovarian cancer syndrome, which is obviously bad for the body, and it leads to basically different type of cancers. Not only ovarian cancer, not only breast cancer, also for, like I mentioned, for prostate cancer, pancreas cancer, colorectal cancer. So lung cancer. This is where everything boils down to. This is the main heart of the whole conversation that we've been seeing since. If this gene, BRCA1 and BRCA2 gene doesn't come to the aid of it, or if they are mutated and that means they cannot come to repair, and they grow and they alter. And that means the DNA damage grow over time, and they alter the whole sequence there, and it leads to breast cancer because the tumor increase, then there's no aid to come and help them, and it keeps growing and growing and grow till it leads to a breast cancer or any cancer of sorts. Thank you. That's all.
Yeah, so thank you for that. So in a nutshell, there is something I want you to quickly talk about, Kola, if your mind is still there. In a nutshell, what is your work? What are you trying to do with your work? So, and yeah, so that's it. Tell us about what you are doing, what your project is all about, how you are going about it, and what do you think the implication of your project would be?
So basically, my project basically is obviously related with Nigeria, and it's basically breast cancer in Nigeria and the mutation differences of breast cancer in Nigeria. Basically, like the mutation sequence analysis of breast cancer in Nigeria and BRCA1 and BRCA2 gene mutation differences from 1950 to 2000. Basically, it's the difference changes in the mutation from samples from 1950 to date. So I'm basically identifying the changes in the mutation of these cancers that people have had, that females have had, because I'm basically dealing with women. So that's what it's going to be. So the change in the mutation from 1950 to 2020. So I'll be checking on the mutation changes and what's the significance of it and everything, understanding the mutation changes. And this in the long run helps in giving a better a better treatment for breast cancer and the mutation, basically. So basically understanding the differences from 1950 to 20, we know how it changed and what it entails, and it helps for better understanding of the mutation, basically.
Yeah, so I think that in a nutshell is really, really interesting. So, who has any comments? Who has any inquiry? Anything that is not clear regarding breast cancer that I can answer or the caller can try to answer? So, is breast cancer not clear to anybody from the literature? You guys are that is not on the cross here, so he has done his part. It's me taking over. So, what do you think? You would still like to know about breast cancer that you think caller has not mentioned? Anybody? Please, guys, don't waste my time. Let's work together. We are just helping each other out. So, Gentle.
Yes, sir.
Okay,
Yes,
do you
sir.
have any comment? Do you have anything to add to this discussion on breast cancer?
I don't know if he mentioned about if he spoke about epidemiology. I don't know if he did that, but I know he spoke about pathogenesis. I don't know if he spoke about epidemiology about breast cancer.
Yeah, I spoke about epidemiology of breast cancer.
So, yeah, Kola, quickly, what is the status of breast cancer in Nigeria? Can you tell us? So that will pull out the conversation on epidemiology.
The status.
Yes. As in, what can you say about breast cancer in Nigeria?
Okay, so basically, breast cancer in Nigeria is the most common cancer. First of all, that's the most important one. Then it is obviously a dying topic that needs to be talked about because of it's not basically talked about in Nigeria like that, and is what's happening now? It's a very, very serious disease that it keeps increasing in Nigeria. It's not reducing at all, and the medical information that is being spread around is not enough at all. And among the citizens of Nigeria, basically the women, they are not ready to. They have not been educated enough about about cancer, and this is the main cause of the breast cancer increase in Nigeria. And like I mentioned before, when I was in the slide I mentioned, there's this prolonged denial of, oh, I can have cancer, or the awareness, they don't have the awareness, or they go for herbal spiritual treatments when when there's not been solution at all. So and even the fear of mastectomy could lead to also breast cancer because of, like I mentioned, from mastectomy is the removal of the old tissue basically. But if you don't remove it, if there's need for that and you don't remove it, it's going to lead to death. So if people don't want to do that, so they end up not even coming back after that they have been identified that they have breast cancer. And also poor health condition and inadequate facilities in Nigeria leads to that too. And ill-formed perception about this breast cancer too can also lead to breast cancer. And this our religious belief basically affects the whole idea of breast cancer in Nigeria, and the list just keep going, and it basically affects cancer as a whole in Nigeria.
Yeah, Christabel, any thoughts on breast cancer? This is an open conversation, please. You are not, and caller, please don't take as if anybody wants to expose you. No, I'm not tackling you. So please, guys, let's open
No, I want
up.
them to even pour out more questions.
Yeah. Please, guys. Christabel. Yeah, Elijah. Abi, is it no?
Yeah, I just want to have a good insight about the breast cancer, like the diagnosis of breast cancer, like color, like how is it done, like sample, like how is it taken from, like how do you know someone has breast cancer if the person comes to you like has a complaint about breast cancer, like how do you check for the lumps and everything?
Caller, can you take that?
Yeah, I can take that. Yeah, basically, there's also self what they call it, self and check, whereby you do this random breast check to check around the armpits for lump or around the breast and features of it. But if the cancer has not gone to that stage whereby it's already obvious in the body, there's this fine needle aspiration test that is done to collect samples from the affected area or the possible affected area. And there's also mammectomy or something. Sorry, I'm trying to remember the name, but it basically is a scan of the area, basically like X-ray scan to identify, because that's the most important thing. That's basically where they get that's how they know there's a cancer. Basically, that's the most important
So,
test.
caller, the method you are trying to mention is mammography.
Yeah, mammography, sir. Thank you very much, sir.
So it's like an X-ray, but it's
Yeah.
not X-ray. They put it's a scan, breast scan. Okay, now if I would add to that, this is what happens in breast cancer. Okay, regularly a lady is expected to carry out self breast examination What self-breast examination means is that because uh, individual body is different, Kola's body is different from Gentle's body. So a lady is the one that knows her body more than anybody, even more than the doctor. So when she said, when she does self-breast examination, there are specific. You said random. No, it's not random. There are specific. Um, there are specific parts of the breast that she has to touch so that she'll be able to feel if there is an abnormal growth, something that is growing where it ought not to be. Now, so that is on that part. So when she does that, I think I want to I want I'm trying to see if I can show you so that this sticks permanently for everybody. So self-breast examination is the starting point. It's actually a prevention too. So because if something is growing, if a tumor is growing, she'll be able to do it. She'll be able to quickly check it out. I want to know whether this one will be able to. Is a guy.
Hello everyone, I'm Dr. Rohan Khandelwal. I head the Department of Breast Disease and Cancer Care at CK Birla Hospital, Gurgaon. And I'm joined today with my very dedicated team nurse, Supinder. And both of us are going to tell you about breast self-examination. Now, before I tell you about breast self-examination, just
Tell us breast self-examination.
terminology we say these days is that a lady should be breast aware. Right? So that doesn't mean doing it rigorously every month, but just every now and then to make sure that there's no change or developing in your breast. Now, another thing which I want to tell you is that breast examination done by yourself should not be done in isolation. It should be part of the screening process, which includes a regular checkup by your doctor, which is either your gynecologist or a breast cancer surgeon, and regular mammographies as well, which start after 3 years of age.
So, Kola, did you get that? So, it's not just the self-breast examination. A woman does it because when she notices something is different, or maybe she doesn't know how to properly do it, a health expert too can also do it, so that they'll be like, okay, this does not look normal. Then this self-breast examination does not replace mammography. And at what age did he say that self-breast mammography should start for a woman?
Yeah, so basically, it should start.
He mentioned it. So what did he say?
Oh, you mentioned it. I didn't even hear. I found
Who
that
got it? Who got it?
from age 40 to you should start starting. You should start age 40 45. You should be ready.
Yes, it's 40. So please, guys, listen, because we are histology students. Cancer is a major selling point in histopathology, and breast cancer is the most popular. So this is not just about color, this is about everybody. This is the reason why I'm pulling this for today. So
regular mammographies as well, which start after 40 years of age. The mammogram, which is either your gynecologist or a breast cancer surgeon, and regular mammographies as well, which start after 40 years of age. So to start with breast self-examination, the earlier guidelines were that it has to be done every month, but now it can be done even on alternate months, but you just need to be aware that there's no change occurring in your breast. For those ladies who are still getting their periods, it should be done on day 5 or day 6 of your cycles. In those ladies, when the periods stop, you can do it on any day. You can just mark that date on your calendar and just keep on doing it on that date on subsequent months. So the first thing the lady has to do is that she has to stand in front of the mirror and put both her hands on the hips, just like Supinder is demonstrating. And when she does that, she has to see if both the breasts are looking equal. Is one breast looking bigger than the other one? Is the nipple on one side higher as compared to the other side, or is it being pulled inside? So these are the things that you need to observe on your own. After that, the lady has to put her hands above the head and then see if the nipple is being pulled inside on one side, or is one nipple riding higher as compared to the other one. Once you've done this basic checkup, then the next part happens when you're taking a bath in the shower. So in the shower, what we recommend is that you apply soap on your hand and some soap on your breast, as this increases the sensitivity of you detecting a lump. The lady should keep one hand behind her head, and if you're examining the left breast, then it should be done with the right hand. Now, a word of caution here. Whenever you're doing the self-examination, it should be done using 3 fingers, and the palm of 3 fingers, not the tip, please, the palm of the fingers, right? And never feel the breast like this. Never put the breast tissue between your thumb and 4 fingers. Because if you do that, you always feel a lump. And I get at least 20 such patients in my OPD that they say that they're feeling a lump, but in reality they just do the examination in a routine manner and they pick up a lump, when actually there's nothing there. So again, with 3 fingers, the pulse of 3 fingers, hand behind the head, and then you feel for the breast in a circular motion against the chest wall. The same process has to be repeated on the other side, and you should feel for the area behind the nipple right at the end, because that area can be sometimes a bit sensitive. So this entire process just takes around 5 to 7 minutes, but it can help you detect a breast lump early. I hope we've discussed the process with you in detail, but as I've told you, this should not be done in isolation.
Now, so that is like the first the starting point is like the starting point for breast cancer screening. When a woman is when a woman is having issues, when she's suspecting that she has that's like a routine process that is expected to be carried out. So when you are doing this every day, you're able to quickly notice if something is wrong. Now that is the starting point. So that's self-breast examination. So after you've carried out, a woman has carried out self-breast examination and she's suspecting something abnormal in her breast. This is where expert comes in now. Like if you remember, he said you check it yourself, then a female gynecologist also checks it out. So when the gynecologist now checks that breast out and still sees that something is actually wrong, there is a growth that is abnormal in that breast, that is where the cytology department comes in. So they refer the patient to the cytology for fine needle aspiration, FNAC. Are you getting the order? Self-breast examination, gynecologist checks it out, then it comes to our laboratory for fine needle aspiration. In fine needle aspiration, what they do is that they insert a needle into the breast to identify the lump and collect samples from that lump. So when samples are collected from that lump, then they transfer it onto the slide, still using perpendicular staining method, and we check for abnormal cells. So that is the pattern. That is the pattern. So when they check for abnormal cells and they are able to see that, oh, these are look at.
So we can not hear you. I can not hear you for like a minute or something.
Sorry, I think where did that disconnect?
From when the slide, when the test is put to the slide.
So when we do FNAC, we transfer onto a slide, we check it out under the microscope. And if you remember the class on criteria for malignancy, if you are seeing all those features consistently and in large numbers, then we can say that, yes, this tumor from where we collected the sample from is more likely to be cancerous. So So now we have to help the patient. Our result is now sent back to the clinic. Like, what do they do? If it's a small tumor, can they surgically remove it and save the breast? Or if it's a very big tumor, has it gotten to the level of mastectomy? So that is how, that is the pattern, that is the flow, and that is how interpretations and judgments are made in cytology. Now, so yeah, so that is how that question can be answered. So Elijah, are you okay with the flow? Do you understand the flow now?
Yes, sir. So I have a question, sir.
Okay.
Like we wonder, like the self-examination is a preventive method against cancer, yeah. And my question is, the girls, ladies who go for breast implants, I guess silicone to make their boobs grow. I want to know if the silicone can, in the future, like cause breast cancer.
Well, if the cells of the breast are irritated by the silicone, they have a problem. But I think they regularly go for checkups. The person that fixed it would always tell them that, okay, come back around this time. Let's check if the silicone is still okay. So at those visits, that is when they check if the silicone is not causing problem to the surroundings. But if the woman is doing what she's expected to do, if she's going for regular examination, if she has that silicone implant and she's going frequently, and they are checking it out to ensure that things are not going haywire with the breast, I don't think she would have to worry about breast cancer.
Yeah, okay, sir. Thank you, sir.
Yes, sir. I also have a question. We have just talked about detecting the breast cancer. There's this particular thing I always hear that if the cancer is detected early, yes, that it can be solved. But is there what is the time span in which the breast has to be cut off, like the cancer has grown too far? Like, is there a time span on this where you can be helped, the lump can be removed, or we just have to remove the whole breast totally?
Yeah, this brings us to the issue of cancer staging. There are breast cancer staging. Kola, did you see anything on? Did you read on breast cancer staging?
Yes, sir, I read on. I presented on it too,
So
sir.
can you take that? Can you answer that question?
Basically, he's saying that is there anything that can. Basically, his question is that is there anything that can be done when the cancer is already going to the later, like the end stage, Abby?
No, like the time, is there like a particular time span on which, okay, they know, like from the point of detection, or maybe if it has lasted for 5 months like this, the cancer would have reached certain stage and you can be helped or you can't be helped, or if it has lasted 1 year or something like that. I wanted to just know if there is like a chart or a time span, and when is it you can when at what stage can you be helped, at what stage can, like, the breast has to be removed totally?
So basically, at the stage that I know you can be helped is from stage 0, because basically stages from stage 0 to 4. That's 5 stages. From stage 0 to 3, there's a possibility that yes, you can be helped from that, but it's not 100% sure, because even at stage 2,
Kola, sorry for cutting you short. I think you should tell them what's happening. What is stage 0, 1, 2, 3, 4?
Okay, so basically, stage 0 is when the tumor is at the duct. The duct is where the milk is already coming, where the milk comes out from for the breast, basically. So basically, that's basically where that's stage 0. So the tumor now is at the duct. It's very little. It's not even up to 2 centimeters yet. It's there, so it's present. There's a presence there. So stage 1 is where the cancer cell as it start increasing to 2 centimeter. This is not obviously large. It's still there. So basically, that's stage 1. It's still there, and stage 1 too. It can also spread to the lymph nodes too for stage 1. After it has really increased like 2 centimeters. That's stage 2. Now the tumor at the dot has increased to like stage to like 2 centimeters upward or 3 centimeters, and it has already increased. It has already now spread to lymph to more lymph nodes, because lymph nodes are around the breast. Basically, lymph nodes, like, it can be around that collarbone area. So basically, that's where. And sorry, auxiliary lymph nodes too at the armpits too, because that's why they check around the armpits for if there's lump there. So basically, that's stage 2, whereby the already increased to 1 or 2 or 3 lymph nodes, and it has already increased like to a size of like 3 centimeters. Then stage 3, now you start seeing the signs on the skin of the breast. The skin of the breast is getting hardened. That one's already very, very obvious. Now this is already now that moved to up to 9 auxiliary lymph nodes. You can understand, and is now in the size of this has increased to like 5 centimeters larger. That's stage 3. Then stage 4, it's already gone to other parts of the body, and once it has gone to other part of the body, the risks of you getting an help or from chemotherapy, from surgery, from radiation is very, very low, basically. So like you said, if there's like maybe if it will last for 1 year, this that, there's a successful rate of 5 years, basically, whereby you start treatment like for 5 years, and it's possible that after that 5 years the cancer will have gone totally, or the cancer will not even go at all, will kill you, basically. And most times the death rate is basically when you detect it at maybe closer to stage 4. Even at stage 3, it's possible that the size of the tumor at stage 3 has increased. Basically, the deaths you're talking about is determined by the stage or the size of the tumor. If the tumor has increased and it can't even though you surgically remove it, it doesn't remove. And all this procedure, all these things, it's not as if it gives a confirmed or 100% solution, because even at surgery, it's possible that you can even die in the process of surgery, and it's possible that as you are doing the chemotherapy too, it doesn't, because chemotherapy is meant to shrink the cancer cells. So because after chemotherapy, you still have to do surgery, and you still have to do chemotherapy again. So there's post chemotherapy, blah 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 blah. Because you do chemotherapy first, then after the surgery, then do chemotherapy again to confirmly remove the cancer. So basically, the most important thing is that identifying the cancer at an early stage. And if you start checking for cancer at the age of 40, but it doesn't mean that you can't still check it at a younger age. But at the age of 40 is very, very important that you already had the mentality of, okay, yes, I want to start checking my cancer. And also at the age of 50 to 55, you should start doing it yearly, because you can't do twice a year. That's the scan, basically. There's this the X-ray mammogram that the coach was talking about. So basically, it's very important that you identify this cancer cell very early, because if you don't identify it early, the rate of it not even being able to even cut off, even because of the breast, is very, 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 very low, basically.
Yeah. So, any thoughts, Christabel? What do you think? What do you want to add to our deliberation?
Nothing really.
There was. Okay. Yeah. So, Kola, thank you very much. There, who knows why Ronnie is just sneaking in and out too. He used to have very good internet before. What happened? Or is it the one that, or is it busy today? As always, he has not been attending classes. Then the rest of you that have not been attending classes, I hope you shall know what you are doing, no? Because me, I've said my own. I